Yes, good morning, everyone. My name is Jenny Cibeles. I'm the New England Regional Director at Hispanic Federation. Welcome once again to our monthly virtual Cafecito series, a series that is intended to highlight the work of our member agencies and subgrantees, empowers our community, and connect families to organizations, programs, and services in the community. Hispanic Federation is the premier Latino nonprofit membership organization, founded in 1990. Hispanic Federation seeks to empower and advance the Hispanic community, support Hispanic families, and strengthen Latino institutions through work in the areas of education, health, immigration, civic engagement, economic empowerment, environment, and many others. Today, we will be discussing the importance of fostering equity and inclusion in policymaking and program development with local leaders. We have a great panel, so you cannot miss. This is going to be a quick steps for you to know how to engage with our panelists. And hopefully you will continue to follow out through the conversation so you can chat with us or just put and add your comments and feedback on the chat. Without further ado, join me with a cup of coffee or tea or water, whatever you think more comfortable, and let's welcome our first panelist. Saludos.
Hola, hola, ¿qué tal?
Muy bien. We are happy to have you here. And now we can start this hot topic, especially because in the most recent months, we have seen that there has been celebration around a national level and state level around different type of culture and ethnicities that have been celebrating their heritage. But let's talk about you for a little bit. Stephen, you are the executive director for the Commission of Women, Children, Senior Equity and Opportunity. And that is a long title, but I'm sure that you do a lot of work. And I know that prior to serving as executive director, you also served in the Connecticut State Legislature as a director of public policy and research for the Connecticut Commission on Children. But what our people might not know is that you served 7 years as legislative and budget director in the office in Washington, D.C., as a council member of Jean Graham. You also received a bachelor's degree in art at Barrington College in Vermont in 1995. Nobody's talking about age here today. And a jury director degrees from the Washington College of Law at America University. So definitely you are very well prepared and well seasoned to lead this office. Tell us how what has been your experience in leading this office for the very first time?
Well, I'll tell you, thank you. Firstly, thank you so much for having me here today. It's an honor to be here. We've worked with the Hispanic Federation now for many years in various ways, and it's always been a partnership that focuses on the work that we have before us, which is so critically important. You know, for working in this space, it's interesting. You know, you mentioned the Commission on Children, where I was policy advisor and director for a while, and also I was also the lawyer for the organization. And what's interesting about the evolution of the commissions and how 6 commissions became one, it tells the story in a lot of ways of Connecticut. The former 6 commissions were women, children, seniors, African American, Latino and Puerto Rican affairs, and Asian and Pacific Islander. They are now under one umbrella, which is here at this commission. And in some ways, the story of how those commissions were consolidated over the years really told the story of how in Connecticut, we really thought, you know what, we are post a women's issues world. We are post a person of color world. Are the commissions really relevant anymore? And then the last couple of years happened. And what happened in the last couple of years was an opening of the Pandora's box, where we were able to fully ground ourselves in all of the work that is yet to be done in equity and opportunity. One of the things that I lead with here at the Commission is that equity means getting us to a level place. Opportunity means exploiting all of those ways in which we want to advance ourselves as individuals, as families, and as communities. So that's the way that that we run the experience here. And I'll tell you, as a policy advisor to the legislature that also faces community, I'm just really honored to be in this position.
That is great. And it's amazing your trajectory, right? And how your expertise now it comes to serve much better our communities in the state of Connecticut specifically, leading all these departments in advancing equity for all. So thank you for that. And I'm sure that there might be many questions moving forward. But right now, I wanted to highlight while we're talking about equity and inclusion. Hispanic Federation, in fact, fights for equity and inclusion in all the areas of our work. We seek to empower and advance the Hispanic community with a unique understanding on these issues. And it's based on the reality that our Hispanic community shares a strong cultural bond through our uniquely pan-ethnic and multiracial heritage. So you talk about how you incorporate all these ethnicities and cultures in your work. And one of my questions for you is really, what has influenced your thinking around inclusion, diversity, equity, and motivate you to get involved in being an advocate for change?
Well, thank you for that question. What's interesting about the Latino experience, I think you hit it on the head, is that for us, there is diversity, both cultural, linguistic diversity, there is economic diversity, all of the experiences of our different coming together of cultures. As difficult as some of those experiences were, as fraught as they might be in some of the places that we're from, it's a story of colonization. It's a story of love. It's a story of coming together. It's a story of socioeconomic disparity. There are so many lessons that we from our own families as Latinos can teach in the United States. What's really powerful about the example of the United States is that from its inception, we have had diversity in this country. We have had the influx of cultures. We have had the expansion of this country into lands that had been populated for eons by native peoples and then for hundreds of years by other people from other places. And what's interesting is that as this culture expanded, there was a quieting of other cultures. There was this mythology that there should be one way of viewing the world and one way of presenting ourselves. We used to call it the melting pot, then we called it other things. But in essence, it was a quieting of the other, and it was an othering of those people who were new to the American experience. And what we're trying to do now in diversity, equity, and inclusion is we're trying to undo some of that. There's a mythology that there is very little talent that comes from Latino populations or populations of people from other places. We know that's not the case. When there's an effort to diversify a workplace, where do we find qualified candidates? They ask, and we say, here we are. So the real task, I think, at hand for diversity, equity, and inclusion is to get rid of some of the mythologies that were created and perpetuated by those who wanted to homogenize the experience of the United States of America.
Absolutely. And I think that goes to the next question, the dangers of us ignoring, the diversity, equity, and inclusion in all the aspects of the government, power, education, economic development, etc. But give us a more concrete ideas and understanding for those who are seeing us today of what could be those long-term consequences.
Well, I appreciate that you asked that, because oftentimes when there is consideration, and I'm going to focus on Latinos today and on Hispanos, when there's consideration of our cultures, of Latinx or Latin culture, often we are looked at through the lens of outcomes and deficit first, right? We're looked at, oh, there is poverty in this community, there is emerging in this community, there are family dynamics that we don't quite understand. And rather than seeing the Latino experience as a real asset for this culture, there is so much that we can teach. One of the biggest initiatives that we have in the state of Connecticut is this notion of multi-generational success. So I ask your viewers, can Latinos teach about multi-generational success? We are the example in the way in which our families are molded together and run across generations of multi-generational success. There isn't a family without a grandparent, right? And either the grandparent or the memory of your grandparent, which ties together the work. The family of generations informing each other, whether they be in the direct family or an extended family or in community. That is part of what we do. And for us to, in the state of Connecticut, wanting to emulate that multi-generational success practice, not only in lifting each other up, but also creating opportunity across generation is really important. And so I think when we think about the emergence of Latino populations, there's also a diversity in the way in which we arrive in this country, which is very important to understand. There are Latinos in this state that have been here for generations. There was a large Puerto Rican diaspora that was part of the founding of the state of Connecticut's Latino population. There are more recently emerging communities that are Latin. It's important to understand each of these communities for the uniqueness that they bring, and that's part of the work of really lifting up that equity and inclusion that we're talking about.
That is important, right? Because understanding the history and the trajectory of our community here in the state of Connecticut, we can identify gaps and opportunities on those specific communities and generations, as you mentioned. Let's talk a little bit about your agency in particular, specifically the commission, as is called, because I know that you have done a lot of initiatives. And most recently, you have put together research and work around diversity, equity, inclusion, leading these topics at the state level. Tell us about what has been your milestones and what has been your success stories from the commission in recent years.
So I'll tell you, I think one of the aspects of our work that we're most proud of is really being able to communicate how it is that law and policy impacts people at a very real level. And whether you're talking about laws that are created by the state, laws that we have inherited across generation, or even policies that are being developed at this moment, how it is that we spend money, they impact people very directly. Oftentimes what happens is that those laws are developed by people who are in a vacuum or are representing a very specific part of the Connecticut experience. And that's fair. We are a representative democracy here in Connecticut. But also it's important to understand that there are voices that are not heard by their representatives. There are voices, for whatever reason, it might be because of language access, it may be because of a lack of civic understanding, which is on us, not on them. So part of the work that we've been so proud of is actually expanding our civics initiatives to really look into community and help communities have the tools of civic engagement. And one of those tools, of course, has been the historical Parent Leadership Training Institute. This is an institute that is provided free to families across the state of Connecticut in their communities, 25 weeks, every once a week. A parent and their family comes to an area where the training happens in community. They are served a meal. There's childcare for the little ones. For the slightly older ones, there's also a Children's Leadership Training Institute. This is people in community learning how to access their government and their democracy. Critically important. We're very proud of that work. And most recently, we're very proud of our role in the development of racial and ethnic impact statements for the state of Connecticut. Not only the work that we're developing for the legislature, but also for communities. A racial and ethnic impact statement is a simple document that looks at a law or looks at a budget initiative and says, how is this going to impact people across the state based on race and ethnicity? Why do we ask that question? Because data has told us that over the generations, the impact of the policies and the money that we spend has impacted people along race and ethnicity lines in disproportionate ways. We're trying to figure out how we can counter that so that we can all have an opportunity once we achieve that equity.
Thank you so much, Stephen. And I want you to stay with us because we're coming back with you to talk about specifically and more in depth about the Children's Priority Commission. And I know that you have a lot of campaigns around that. But now let's and let's introduce our second panelist. We have Moy Moynihan. She is the clinical director of adult residential services with Rushford and Hartford Healthcare. She is a Chinese American refugee from Laos who is a passionate advocate for health equity and social justice. And we want to bring her on board for this conversation so she can bring a perspective of the Asian community specifically. Mui, welcome. Thank you for joining.
Thank you so much. I appreciate the opportunity to be able to share some insight and also join Steve. And, there's a lot of great work that's being done, and we absolutely appreciate opportunities where this can be highlighted. Thank you.
Mumi, let's talk about your work on healthcare, the one that is specifically, address healthcare gaps and how disadvantaged minorities are affected by. I know that even though not everyone has, a basic need for high quality healthcare, this discrepancy in healthcare status and access continue to exist. And these gaps are really being reflected at larger social and economic divides. More important, we have seen this increasing gaps in the minorities communities after the pandemic. Please tell us a little bit of that.
Thank you so much for that question. And before I get into my response, I did want to share a quick statistic. So in the United States, from 2010 to 2018, the AAPI community has risen 25%. Let me repeat that statistic. The AAPI community in the United States has risen 25% from 2010 to 2018. The Latinx community has risen almost 18.5% from 2010 to 2018. And the Black community has risen almost 7% in the United States. So I share these stats because it's very important to know who our communities are and how our communities are changing. It is also really important to be able to recognize the multiple diversity that we have. Healthcare is an important, it's an important issue for all of us, and we should all be able to access quality healthcare that you were referring to, regardless of our race, ethnicity, gender, and any other identifying, demographic contributor. I think the underserved minority community has always been having issues and barriers when it comes to challenges of accessing healthcare. One of those challenges can always be, linguistical challenges. Services on mainstream are not always linguistically appropriate for individuals that speak different languages. Culture is another huge factor that contributes to access to appropriate quality healthcare. If providers do not or are not informed or aware of specific cultures, they are at a disadvantage when trying to work with these communities. There are various uniquenesses about each of the communities that providers should really be educated and informed about. I can, go on and on and on as to contributing factors where our communities are not able to access quality healthcare.
I know that this is a very personal issue and that you had invested personally in your education and your time to really become an advocate of change. And it's interesting that you share all this data because the reality is that we have seen how representation and access to all type of services and programs at the federal and state level are so important for these communities, right? And it's not like a mistake. It's something that we cannot deny. It's something that we can avoid. It's something that needs to be addressed. And the government, private entities, corporations, everyone in our community as a whole should be mindful of this. First of all, for cultural empathy, but also to understand that we are a larger, and like Stephen mentioned, right, the melting pot, well, how it was called in the 90s. But really, we are a very diverse community. Um, I would like to know the same question that I did to Stephen. What really influenced, what was the trigger for you to become such a passionate advocate?
Thank you for that question. I really enjoy answering this question because we're able to bring a personal aspect into our work, right? I think all of us are motivated by personal, connections and experiences. I think for me, this started early on as a child, realizing that I looked different. I spoke a different language. Coming to the United States, really with no supports and resources, no extended family. As a refugee, we came here with the clothing that we were wearing. And as my parents were very young with two little girls, they did not speak the language. They did not know anybody. We were very fortunate to have been sponsored by a local church in Wallingford, and they were able to really have some congregation members take us under their wing, and they became our extended family. I feel like going into school, people not wanting to say my name because it's difficult to pronounce and it's very different on paper, MUI, MUI. A lot of people did not recognize this name. They were unsure as to how to pronounce it. Back then, instead of asking me, they would just overlook or mispronounce my name. It got to the point where they were doing it on purpose. And absolutely, I was bullied as, a young child into elementary, middle school, high school. Um, I think when we had health issues were the only times that our parents really took us to any medical professionals. I do recall having to go to the emergency room at a very young age because of an accident where I fell and hurt myself. Um, it was where my sister and I were playing hide and go seek in our apartment. My mother pulled down the oven door because she was baking a cake, but she was letting the cake kind of cool off. I was very clumsy and I ended up landing on the oven door, which was still very hot. I ended up having severe burns. So my parents brought me to the emergency room, not knowing any English, but just knowing that their child was crying and hurting and was seeking some assistance. I was absolutely horrified with the reaction and response from the medical providers. They were screaming at my parents because my mom ended up putting some toothpaste on my burns to try to kind of soothe my pain, not realizing that that actually didn't work and that was not useful. But instead of the medical providers taking a second to really just understand that you have a patient and a patient's family not speaking English, they ended up really scolding her in a different language. And I just saw the horror in my mom's face. She didn't understand exactly what they were saying, but she understood their tone of voice and their demeanor and their facial expressions. So I think early on, I realized that this is something that I wanted to be a part of, to be able to help promote and advance change and really work with individuals and families to be able to increase their voice and opportunity, because I had firsthand experience of, where opportunities were not in existence, role models were not in existence. It was very difficult and challenging for our family to be one of very few Asian families growing up as a child in the neighborhood that we were in the town that we were in. So I think there's just a lot of different experiences that I went through where I was able to say, this is where I need to be. I need to be able to be in a field where I can directly help individuals and families, in addition to also making some policy changes as well, too. Thank you.
Thank you, Moi Moi. And I appreciate you sharing this story with our audience, because it really paints a true picture, right, of how long, you came, the experiences, untold experiences, right, from many other immigrant communities, or just people that really were in disadvantage to have access to housing, to healthcare, to education. and how important it is that we continue to improve our systems, to be open minded and open for everyone, regardless their status, regardless their ethnicity, their language, their culture background. So we appreciate you sharing this with you. And I love the fact that you turned that experience, bad experience, right, into testimonials with actual steps of actions, right, to do better. And now we seeing a professional who is really working towards the betterment of our community in many aspects, including healthcare access. Thank you for that. I wanted to continue with you for a quick question, and then I will return to Stephen. In terms of the health access, we have seen that after the pandemic, and we say after, but really we continue to being affected in many ways by the COVID-19, right? Healthcare has become a true matter that we cannot escape from. And we have seen how the government continues to invest, how corporations, institutions, hospitals, and even educational industries have really tapped into managing the crisis that we have now, not only in our communities, but more specifically in our children's. What are your thoughts on embracing mental health into diversity, equity, and inclusions initiatives?
That's a great question, and it's a great initiative that all of us should really be supporting and contributing to. Mental health, especially with COVID, pre, post, still COVID, it impacts all of us at different levels. It's so crucial and important to be able to make sure that our children are understanding what's going on. And then also our children are able to access resources available to them without judgment, without fear. It's so important that we talk about mental health early on. It's so important that we talk about diversity, equity, inclusion, and belonging early on. I have a 12-year-old daughter that I'm very proud of, and I think it really makes it a full circle for me regarding the work that I do. Once again, I think we're all motivated by our family. We're motivated by our loved ones. And I know that I want to make this place a better place. It's very cliche, but it's very true. I want to make this place a better place for her and her generation. But I also want her to take accountability and responsibility of what she can contribute to the community. It's not just about her and her family and friends. It really is about the larger community as well. And she needs to be able to understand that. And I've been trying to educate her and provide her experiences and opportunities from very early on. And I think it's important for all of our children to be able to have these opportunities, to be able to have these sensitive conversations, but important conversations. It matters, for kids to know that they belong, regardless of how they look, regardless of what background they came from. It matters to know that diversity should be welcomed. The richness and the culture that each of us bring should be, something that's highlighted and recognized, not ostracized and made fun of. So I think mental health and diversity go hand in hand. And I think with COVID still looming on us, all of us, it's so important for us to make sure that children have opportunities and access to be able to express themselves. And if they're not expressing themselves, we have opportunity and resources to be able to help them express themselves, because sometimes it's not where they don't want to express themselves or relay a question or concern. It's they don't know how, because they haven't been taught, or their environment hasn't been an environment where it's been educational, or resources have been spoken about, or people are aware of how to actually address or respond to certain situations. So I think as soon as we can, we should be able to incorporate mental health with diversity, equity, inclusion early on in the schools, but also do age appropriate. It's not where you want to talk about diagnosis and symptoms in kindergarten. It's more so of, let's talk about some feelings and emotions that you may have. Thank you.
Thank you for that, Murmuri. And I wanted to share with our audience that if you, for whatever reason, are in this space where you don't know how to help your child, with some of the resources in your city, in your town, your county, please reach out to us. We will be more than happy to connect you with a local nonprofit organization, one of our member agencies and subgrantees that really knows about the resources and the opportunities that are out there for parents to get educated and informed about all the programs. My family, per se, is a multiracial family, and we just recently moved here in this area. And my child is in a summer camp for cultural competency and emotion arts. I did not know that that was going to become an art title, but it is, and she's loving it. She's loving it. She's 6 old, and she is coming every day, like talking about her hair, talking about different cultures, and being sensitive about that. And I appreciate the work that our teachers are doing on that summer camp in particular. But there are many resources, many other programs that really provide the opportunity to children express their feelings, learn how to canalize and those feelings and emotions, to verbalize, to express them, and overall to have a happy and healthy family. So we wanted to go back to Stephen. Stephen, you talked about previously about the responsibilities that the commission takes on, but I would like for you to address specifically, staying in the topic of children, right? The priorities of children's safety and the different type of initiatives that you guys have on water safety and also on the autism spectrum.
Well, thank you for that. Those are two interesting examples of a greater philosophy of the commission. I'll focus on water safety and awareness because it's an interesting story of how the topic of water safety and awareness for kids came to us a few years ago. We started looking at some of the data surrounding water safety and awareness and realized that there were two types of children that were being disproportionately impacted by drowning or premature death because of water. And they were children of color, specifically African American and Latino children who had no access generally to water, and also children on the autism spectrum. So for that reason, we decided to take on the issue. We brought people together from all over the state, some very famous people that have lost children to drownings, like Stu Leonard, for instance, and also people in community who had lost children. One thing that we didn't know that we learned in the process that our families didn't know is that children can drown in 2 inches of water. And that's really important to know because so many of our families don't have general access to water safety and awareness, and yet their children are drowning. Another thing that we learned is that children on the autism spectrum are especially attracted to water for a couple of reasons. One, it's the way in which the water sort of draws the attention, but also the soothing quality of the water when it envelops the child. Both of those can be a peril if we don't know the fact that that's the case. So water safety and awareness is an example of how we took data on disparate impact and we used the data to have an initiative that actually helped keep children safe. Now, I want to talk about our general philosophy when it comes to kids and how it's evolved over the years in the state. You know, for many generations, we thought that children's safety and the success of children was measured in a lot of ways by the child herself. What that means is that if we wanted to help a kid, we would go to the kid. And very often that meant to the exclusion of the parents. And there's a history of whenever a child was in danger, Muy, your story is so beautiful because it really is an example of how it is that for generations we have treated parents when it comes to children in distress or trouble. We assume that the parent is part of the problem rather than assuming that the parent can be a partner in the solution. And so what's happened over the last few years in Connecticut and across the country is that we have really refocused on what we call a whole family approach. And the whole family approach, again, focuses on that multi-generational success that happens within one generation. How is it that grandparents are part of the solution in raising children? How is it that both parents, whether they be custodial or not, how is it that had families that are not traditional nuclear families are also families that are that are the center of gravity for kids. So we know now that keeping children safe and helping children thrive is about the success of the family and about the success of the community. So that's really important, because now what we have is, as we were expecting families to come together and be centralized, we realized, well, wait a second, our government doesn't really work that way. Our systems don't really work that way. How do we start talking to each other in the very same ways that we expect our families to? And how do we become better at providing those services and supports for families to thrive? So when I think about child safety, I think about family safety, community safety, and thriving across all of those different centers of gravity.
And that is so critical. That is so critical for our children, especially in this season, right? Summer time. So I do engage in conversations with parents, students, and teachers around the state, talking about the different type of enrichment programs, about safety, about education opportunities for their children. And one of the things that always come around is swimming classes or water safety, or like. And it is so important that specifically because we are not an island, even where we are on the coast, there are lakes, there are rivers, there are ponds. All those areas are high risk areas for children to be drawn, and we cannot avoid all the cases, but we definitely can prevent all the unfortunate cases. So I think that this is so important for our communities to know that the commission is doing this work, and that you guys have the resources at state level. So please, at the end of this virtual event, we are going to share, and throughout the final minutes of this virtual event, we will be sharing information of the commission, how you can access to some of their resources. They also have community briefings and workshops. So it is important that you stay connected. This is a very busy commission that always is trying to provide the information in different languages as well, and make it accessible to everyone. I wanted to just go around between Mumui and Stephen. What is your take on now in this time where we're seeing that the education in children has been addressed as one of the setbacks of the pandemic? How can we continue to make sure that our children are successful, that our parents are getting into the resources that they need to ensure a brighter future for all of them? And I bring this topic specifically because while we are seeing a summer break after 3 years of the pandemic, we have seen some of the data information showing that children are lacking or are behind on reading, math, and they require a lot of attention on mental health and emotional support. What is your take on this, on specifically diversity, equity, and inclusion?
I can go first. Thank you. So I think it's really important for us to make sure that we have these conversations, like I indicated early on, and that we're normalizing these conversations, right? It's not bad. It's not taboo. It's not, you're getting in trouble. It's these conversations should be happening in the homes and also in other settings. It should be happening at the summer camps. It should be happening at schools. It should be happening all over the place if possible. It really is about bringing opportunities and resources to our families, to our children, but also doing that in a very culturally sensitive manner for underserved, underrepresented communities, minority communities. One of the biggest things that I feel like that is effective, and Stephen, can attest to this as well too, is community outreach. In order for successful engagement to happen, we need to be able to be in these communities, learning about these communities, but then also allowing for opportunity to be able to have these communities learn from us and ask questions and express what their needs are. And community outreach, I always tell providers, is not us in the office on the phone. trying to gather some information or introduce ourselves. It really is about going into the community, attending an event, going into a faith-based, site to introduce yourself and say, I'm Moy Moy. I'm from this organization. I would love to be able to learn a little bit more about you. I would also like to be able to share some resources and services that we're able to provide that you might be interested in. So I think it really is being able to create those opportunities. We have resources, but I think a lot of our families may not know of these resources, or if they are aware of, they don't know how to access. So I think if at all possible is making these resources available, sharing, whether it's media postings or sending out flyers, but also remembering the cultural competence and linguistic competence piece, right? Not necessarily just sending flyers or posting things in English. If you know a certain area has a certain population, then you should be able to offer, translation in the specific different communities and languages that we have. So take, for instance, we know that New Haven has a higher volume of Asian Americans that are residing there. So it might also be a great idea to be able to send some flyers home that are in different Asian languages. I wouldn't suggest every single Asian language because I don't think any provider or agency can keep up with that. It's really getting to know your community and identifying maybe what the top one or two or three are, and then being able to work with some community leaders on being able to get that message across.
That's a great point, Muy Muy. And your last point is specifically for Latinos, right? We are not all Latinos that speak in the same Spanish. We have some of the what we call it wordings that have different meanings, even if you are from the Caribbean or if you are from Central America or if you are even from other places. So it is important that the cultural linguistic competency it's all over our outreach programs. Stephen?
Thank you. I think the policy of language access is a shared value that we are going to be pursuing in this next legislative season. How is it that we can emulate other states who have actually brought robust interpretation and translation services for their emerging and diverse communities? Critically important. If you can't access your government, then your government can't access you. And that's just a simple fact. Now, on the children's issues that you mentioned before, and how it is that we support children more robustly. I'm struggling to remember your question about children. If you could just repeat it one more time.
Sure, it's pretty much now that we are seeing that
Thank
students
you. On education, yes. So look, there's a couple of critical things. There's a foundational element about educational access in the state and, of course, all over the country. The public education system, as much as we support school choice and as much as we support the parents' ability to feel and be as mobile as they want to be, we have to remember that the reason that a public education system was created in the United States was to level the playing field in this democracy and to keep us all as intelligently and opportunistically engaged in the working of democracy and in opportunity, economic opportunity. What's happened in the state of Connecticut is that depending on where you live, you have varying access to that opportunity because of the way we fund educational access. Parents have a right to demand educational access that is equitably funded in their communities, because if it's not, you are missing a vital opportunity to engage in this economy and to engage in this democracy. I think that's something that we forget, is that based on whatever zip code that you live in, you may have less opportunity to be engaged in the opportunities that this country and the state can provide to you. You have a right to demand it.
I love it, and I think that we are closing with a strong call to action, right? We need to be engaged, and pretty much part of the mission of this virtual event that we host every month is to really provide you with information, resources, and connection for you and your family, your neighbors, to be engaged in every aspect of the circle of life that we are sharing here as a community. It is important that we tap into those resources because if we don't get advantage of them, some of those resources might end up, and really it doesn't necessarily means that it's not needed. Also, just get it yourself informed so you can share information with others, because sometimes we seem that maybe our neighbors or children in our schools not necessarily have computers, or they have access to digital devices, so they can apply for these grants or apply for these benefits or applies for those resources. So it is important that we always take a leading role in helping each other, and I think this is a great opportunity for us to learn as well. I wanted to say thank you so much to our two panelists. I'm honored. Hispanic Federation is happy to have you as a collaborators. And we will see more of them moving forward. For those who are part of our nonprofit sector, I want to say that we are pleased to continue to provide support to our organizations to make sure that they have the resources and the opportunities that they need, so they can continue to do the work every single day. More important, we also want to announce that moving forward, on August 19, is the deadline to our Community of Color Stabilization Fund. And this is grant that aims to build capacity for nonprofit organizations, specifically in the Hartford area, around equity, inclusion, and diversity. It is important that you get to know about the details of this grant. It's open, and we are happy to provide you with any further information very shortly. During the second week of July, we will host several community meetings to talk about how to apply, how can you apply for, and what are the different aspects of this grant. So please stay tuned, and if you have any question, like always, you can always connect with our office here in the state of Connecticut. We are Hartford based, and we will be happy to hear from you. I don't have anything else, but I wanted to give the last couple minutes to Miu Miu and Steven for final words.
I just want to say thank you so much for this opportunity. It's always great to be able to come together with like minds and really know that there are others doing similar work. So we are not alone, and this is a collective effort. So hopefully we'll be able to gain momentum and have additional partners and collaboration join our efforts. So thank you so much.
Thank you again. And we are providing the example of how it is that we should be working cross-generationally, across silo, across culture, to create a better community here in Connecticut and throughout the country. So I really appreciate the invitation, and I was so excited to be here with Muy Muy. Thank you both.
Thank you. And if you want to hear more about this virtual cafe or any other that we have hosted in the past, please go and visit our social media platform at Hispanic Federation. Also, you can know more about our organization and our work by visiting our website, hispanicfederation.org. Once again, have a great day. Thank you so much for joining us, y hasta la próxima.